Hi, my name is Claire Howell, and I'll be giving my presentation on the availability heuristics in emergency medicine. So, just to begin, every day we're making tens of thousands of decisions, on average around 35,000 decisions. And we do these without even thinking, really. We don't analyze every single possible outcome, then go back and decide what's the most efficient route or what the best route is, stuff like that. So, we rely on certain things called mental shortcuts, or more specifically, on heuristics. And they're a way that your brain can kind of simplify decisions so you can respond more efficiently and actually get through your day in a timely manner without getting stuck every single second. And one important type of heuristic that I'm specifically talking about is the availability heuristic. And it's essentially when you base how likely or how probable something is based off of how quickly examples come to mind. So, a very common example of this would be talking about plane crashes. Now, I will give the caveat that I don't think this is the best example anymore since it's been so highly publicized and talked about to help people get over their fear of flying. There's stuff like the Jello example and stuff like that. But I do think it is a good example on how this cognitive bias can kind of lead people astray. So essentially, if you are just hanging out in your room and you see a ton of news coverage on a plane crash, or a few plane crashes went down, or just plane maintenance and dangers of flying, you're more likely to be then afraid of flying the next time, or think about yourself as being somebody who's afraid of flying because these examples are more vivid or more salient. If you look at my diagram right there, you're relying on information that's more recent, extreme, or negative, especially and memorable. So the example of a plane crash would be especially negative and frightening, and therefore is more salient in your mind. So you're more likely to think that this type of event is more common, which would then lead you to be afraid of it. One example that I do really like a lot better, and we did touch on this in class, but the one that I specifically read was with the letter K. And so I posed this question as there was a study done, and they asked participants, do you think there are more words that begin with the letter K or that have K as the third letter? They let them respond. And a lot of people would agree with the people in the study that there are probably more words that start with the letter K. This is because it's way easier. Your brain has a way of navigating, like kind of searching an index. And it's much easier to do that with words that start with the letter K rather than kind of having to go over and be like, okay, I know the word or the letter K is in this word. Now, where is the letter K within that word? I'm not sure. Let me figure that out. So it's much easier to just be like, okay, I can think of kitten, kite, stuff like that, than thinking of words like maybe acknowledge isn't really going to pop into your head immediately. And I know when I did the study to myself, I couldn't even think of any word that had K as a third letter. That felt like such a random consonant to have in there. But in reality, there are way more words that have K as a third letter than start with letter K. So I know I just gave two examples kind of on how this kind of the availability heuristic or these cognitive biases can lead you astray, but it's coming from a completely normal and intact cognitive process. So our brains are designed to use our memory as efficiently as possible. Like I said, we make so many decisions every single day that it would be completely unreliable to navigate through every decision really in a regimented routine. So we're trying to do this as efficiently as possible. And we're more likely to recall things that are, again, vivid, salient, more recent, more emotional, stuff like that. And so these are the examples that are coming to your mind first. And most of the time, this is helpful because it allows you to quickly use past experiences as past memories to guide your decision making without having to think all over from scratch every single time that you need to make a decision. And these memory processes are shaping how you can think faster. So they're doing an amazing job at that. But again, they're also the same systems that are shaping your memories in ways that aren't necessarily always accurate. So it is kind of a bit of a give and take. Now, if we look down to the top down and bottom up processing, which is something we've obviously been talking about all semester, so we'll touch on what it is really quickly. But again, this is something that I hope we've established very well. Bottom up processing is what's driven by incoming information, so something that's like right in front of you. And the example of the availability heuristic, take like the plane crash. That's something right in front of you, like the news coverage is something vivid, noticeable, and very in the moment. That's what you're seeing. Um, and for example, I guess if you had like a more dramatically or emotionally intense event, so again, the plane crash, that's more likely to stand out in your bottom up processing. And then top down would be kind of the opposite then. So it's what you're coming into the experience with. So it's all of your preconceived notions, past experiences, judgments that you bring into each situation. And in the case of the availability heuristic, it's kind of the bottom up processing helps explain why certain things are sticking out much more memorably to you and then are encoded more strongly into your memory in the first place. While the top down, on the other hand, is then explaining how we use these memories in the future to make these judgments that aren't always correct, but our brain believes that they're the most likely. So together, they're kind of just explaining why these certain things seem easier to remember, and then they end up feeling more common, therefore more important than they actually are. And if you look down, I kind of have a flow chart of underneath the top down and bottom up processing where it's vivid, recent information, then becomes easier to recall Therefore, it feels more likely, which leads you to a decision. May not be always the correct decision, but it leads you to some form of decision. And that first spot, the vivid or recent info, would be your bottom up processing. And then easy to recall is kind of where your top down comes in. So that's kind of, I think, an easier way to think about how these two types of processing come into play. Now, moving over to what I think is arguably the more interesting part of this presentation, how it affects people in the real world. So my study looked at whether the availability heuristic affected physicians in their daily lives, like in their work and in diagnosing people. And it focused on how doctors assess patients with coming in with shortness of breath. And shortness of breath is sometimes a symptom of a pulmonary embolism, which is a blood clot on the way to your lung. So you present kind of like this, and that's a very common presentation of it. And the study looked at each physician and they tracked them over time. So it was looking at an individual physician over time and seeing what this specific doctor did after diagnosing somebody with a pulmonary embolism. So it was kind of trying to see if this event of the initial diagnosis of a PE was like the salient or extreme event that would trigger then the availability heuristic. And so you would see the effects of the heuristic on their next patients. So the way that they did this was tracking each doctor and seeing if they ordered tests that usually accompany a pulmonary embolism, so a D dimer and a CAT scan. And they looked at, we'll look at the graph in a second, but they looked at the days following. And the research question was essentially, do doctors or will doctors become more likely to order these tests shortly after diagnosing somebody with a PE? And now if we look down at the results, there's definitely a clear short-term effect. As you can see in the graph, like the physicians were much more likely to order tests for a PE to be done in the 10 days following a diagnosis of a pulmonary embolism. So if you look specifically, you see the biggest increase from days 0, so right after they diagnose somebody, to 10. And this is about 15% up from their baseline average of ordering these tests. And you can see that even though it does start to go down after day 10, like the graph stops at day 40, you can see there's still a significant increase, about 7% compared to baseline. So even though this big spike could be considered short term, the doctor is still dealing with the effects of the availability heuristic much, much later, almost like a month or more than a month down the line. Um, and my main takeaway from this was even in high stake environments like medicine and emergency rooms, people are still very susceptible to these biases. And I think we can all agree, or I hope we can all agree, that these doctors would be considered experts in their fields. And I know we've touched on expertise a little bit in this class, but I want to make the point that even when you're an expert, you're not immune, I guess, to things like cognitive biases. Like they are very much affected by this, as you can see in the graph above. And even though they're trained and their judgment's just still shaped by what's recent and easier to recall. And I think in this situation, most people would agree that they would want the availability heuristic to essentially take place because when you think about it, if you can't breathe, you would rather your doctor kind of go off of what's worked in the past and try to get you to a diagnosis as quickly as possible, whether that means you may have to do some extra testing or not. You would rather them try as many things as they could than start from scratch and think through every possible thing because at that point, who knows? Unfortunately, who knows where you may be? You may not be with us anymore. So I think many people in the study did agree that it is probably better than what these doctors are doing. But it is still brings up the concern of money and whether these people can do these tests, stuff like that. So there are some things to consider with that. But this does introduce a trade-off because these heuristics, which are improving your decision making and helping you make faster decisions, helping you arrive at conclusions more efficiently, is important, as we saw. But it does introduce small biases and bring in realms of confusion where people aren't receiving their diagnosis as fast as they could be since they do what is now like unnecessary testing. And when doctors do look at like a chart, maybe they overlook things that aren't aligning with their perception of like a pulmonary embolism. So if they think somebody already has a pulmonary embolism, maybe they would overlook some of the smaller things that could suggest that, oh, okay, maybe it's not a pulmonary embolism. It could be something else. Um, but overall, I think the study shows that the availability is like definitely has real world effects and still affects professional people in their professional setting. So it's not like a carryover effect. Like these are doctors working in their profession. And it has short-term effects, but it also does continue more into the long term, even though we do see this decrease in the exact study or in this specific study. And this led me to my research question, which is directly based off of this study. So I was wondering, does repeated exposure to a pulmonary embolism case initially increase perceived risk from the doctor? So as we see here, it does initially increase perceived risk. But then my question was about the second part, which was, would this later reduce their bias through experience? So essentially, would doctors become or start to feel habituated towards these? And now the information would no longer, if we go back to the graph in the beginning with the circles, would this information not be extreme anymore? So would diagnosing a pulmonary embolism no longer be very memorable to them?